Wherever you've been moving to, people have been asking me that, yes, you got into office and there was a lot of excitement, but when you announced the list of the beneficiaries, the vulnerable, those you identify as the vulnerable poor, those who will be benefiting from this initiative, the list, many of them we are going to miss out. And also the 100,000, they are not really comfortable with the money, especially those from the opposition. They are saying that this is way too low compared to the standards of people.
Ugandans must appreciate that we have been able to look for that little relief. As government, you know how the economy is doing. The opposition doesn't know the economy. They don't know how we are moving. But we tried to squeeze. We tried to suppress other MDAs to come up with that small figure, so that our people who are vulnerable, especially because of lockdown, those who were earning a living and those who were used to getting money and then use that very money to survive. We believe because of lockdown, those people are now stuck. And you realize that that category of people are those people who were working as vendors in the markets. You know, these vendors, those who sell food in the arcades, you know, the arcades are now closed. So we believe those people must be struggling now to survive. Then two, remember these Juakali people, those who carry, you know, those who carry the Juakali, those who carry for people in the tax packs. Those must also be struggling. We know that we have slum dwellers, and slum dwellers are those people who are there because they cannot move elsewhere. We also have street children, and those street children, they usually survive because of bypassers. And now that we are under lockdown, those must also be struggling. Remember, we had the schools we have nursery schools. The nursery schools have not been working for close to a year now, and the teachers in those schools must also be struggling. The teachers in private schools must also be having hard time, and many other vulnerable groups.
Right, Honorable, how did you come up with this list of the categories of these vulnerable people? Because even the Uganda Bureau of Statistics is now saying that the list they are having is really way too old. They don't have the unupdated list, and the Minister of Gender says they contacted UBOS, but UBOS is saying that this is not the updated list they have.
Last year we distributed relief in Kampala. At least for Kampala, we have some data, because we have those people we gave relief last time. We gave them food, and that list, the list of those beneficiaries is in my office. We have where to start from. Then we shall also get information from our local leaders. And though it is taking long, but at least we have reached somewhere. And today, I am going to have a meeting with all the MDAs, Minister of Gender, UBOS, KCCA. They are coming to brief me on how far they have gone with the available data, because Cabinet then decided that we shall use the available data, then you know, display that available data, then add, because people migrate. There are those who may have died. There are those who have come in and they are vulnerable. So that available data we have, we are compiling it today and then push it to the leaders.
Won't that be too late for now if you're just having these meetings? Because I know you had looked at 6th July to start releasing the money.
We are still within time. We are still in time, except that now I want to call upon the local leaders to help us. If you know that somebody who is on the list does not qualify, don't hesitate to tell those people we have come with that data to say.
The local leaders, you mean LOC chairpersons and councillors?
The local leaders, of course, the LOCs, We have councillors. We have chairpersons of women at the village level. But we don't want them to congregate. We want these people who are going to survey, they are going to go with these lists that we have. Say, for example, Makerere Kavule. We have Nabbanja here. Is she still in Kavule? And this exercise can take like 2 to 3 days.
When you speak to some local
because
leaders...
this then does not need us to, like the other time, carrying food, doing this, after, verifying that this is a correct list, then we shall take that list to Bank of Uganda, to Minister of Gender, to working with Minister of Finance, working with Bank of Uganda. They will transfer the money to Post Bank, because it's Post Bank we decided to use. Then Post Bank, because transferring it's actually this online EFT. Then Post Bank will transfer the money to MTN. MTN will definitely have that list and the telephone numbers. Then MTN will
when you speak to some, when you speak to some of the local leaders, I'm talking about the religious leaders, chairpersons of local councils like Kavanda Godfrey of Nansana, where I stay, they will tell you that this program is likely to cause some domestic violence, because, take for example, if a woman, the wife, is a salon attendant, the husband is a border rider, and you are saying that you're going to be sending 100,000 to only one.
We are giving a family. We are giving a family. The other time we also gave a family. We are giving a family in a sense that, first of all, people must appreciate that Uganda is still a developing country. We don't have a lot of money in our budget. And remember, here we had to suppress other MDAs. We touched the travel abroad. People are no longer traveling. Travel inland, workshops and seminars. That's the money we really collected to have some little money for our people to survive.
There are some vulnerable people.
Now, if the husband is a border rider, but remember, border riders are still working, despite the fact that they are not carrying people, but they are still carrying a cargo. Then, if the wife is a saloon, or a waitress in a bar, then we shall give the wife. And then the husband, since he's still carrying some little cargo, he will. But if, say, for example, in a home they only have that border rider, then the border rider will carry the day.
I just
we want leaders to appreciate that this is not the end of the world, and government is just trying to help. Other people like donors and other organizations should also come in and help. If you know you have food and you see your neighbor is not okay, please come in and help. We should help each other. This pandemic is not for government, it's for all of us.
I know some people who were arrested last time when they were distributing some food. Yes,
it's a war. It's a war. Today, I'm going to receive some contribution of 530 million from Ham, Chigundu. He's bringing it today at midday, and he's welcome. He wants this money to be used to buy vaccines, one for his people, those he employs, and two, for at least 10,000 Ugandans, those in the field, 10,000 Ugandans. Then three, I also want to talk about the status now. Where are we? Yesterday I got a brief from Minister of Health. They are saying the trend, the infection rate is going down.
Sure.
Yes. Statistics show that the infection rate is going down, and I think these are some of the good attributes. We attribute this to the lockdown. The infection rate is going down. That's one. Two, yes, we still have hospitals which are full. I think basically because if you are infected, when you go to a hospital or any health facility, you spend there between 14 to 21 days.
Okay.
So, but the trend, there is light at the end of the tunnel.
I still want to take you back to the vulnerable poor. How did you, as a government, come up with these categories? Or rather, the summation, the list of those who are going to get, but most importantly, the 100,000, because there are some people, some families. Take for example those Muslims who have a family here, a family there, and some of them belong to these categories. A family has like 6-8 people, and they're going to get 100,000 for the rest of the lockdown period. How do you come up with this money? Because when you speak to opposition leaders, they will take you at least 200,000 will be enough.
We first of all have had to look at a number of things. Statistics show that an average household in Kampala is 4.8 persons. Of course, we had put it the lowest figure, and we came up with 5. You cannot be exact. If somebody has 20 people in a home, somebody has 30. There are those who even we have. For me here, I have 50. I have 50 persons.
And you don't belong to this group.
Yes, I have 50. So by the time somebody has the capacity to manage a family of 30, that one is not a poor person. You can't manage a family of 30 people in Kampala and you claim to be a poor person. But even then, you may be, say, a Muslim, you have one wife here, another one, that is another family, and the other. And maybe you fall under all these categories we talked about. Then you will benefit. You will benefit. You will benefit because if you are poor, and people see, or even when you are not poor, but you used to survive before a lockdown, using, say for example, you had a restaurant that closed, and your restaurant was able to manage your 5 families, then you will survive. They will give you support.
When you talk about the numbers going down, people get hope that maybe you'll be lifting the lockdown after these 42 days. But still,
no, I'm not saying the numbers. The trend shows that the numbers
are going down.
The infection rate has gone down in this last week, as compared to the number to when we started with the lockdown. The numbers are going down, and we attribute this trend to the lockdown. People are no longer, because they are no longer moving and mixing freely. I think the trend is going down. We are looking at figures. Scientifically, the numbers are going down, and this has given us a lot of hope. But even then, we don't want to lose anybody for lack of food, for this and this. Secondly, we also now saw that if, say, for example, a family of 5 people, these remaining days can get 2 kilograms of posho per person, that is 10. You know the cost. Then we said somebody maybe, or even you can use other means. There are those who don't even eat posho. When we categorically calculated all of this, we saw that 100,000 can ably make a family of 5 people go through the lockdown. We cannot give them 100% or what they need, but this is a contribution. It's a contribution. We know somebody can survive with or without this contribution. But this is just a humble contribution from NRM government, a humble contribution, having put our heads.
These 42 municipalities and
the
cities. Some people are thinking and are saying that, look, government should revise the plan, because there are even other people maybe in rural areas, they sup around 6 p.m. just to be sure that they sleep before, because they don't have power, they don't have money to cater for paraffin. They are also vulnerable poor within the village areas.
We are still struggling to see that we now go up to the municipal councils. Why? Because we don't have enough as government. In our town councils, I don't think anybody can die in a town council of hunger. Because we did not really lock shops in the town council. The town councils, all the shops are working. Apart from bars, restaurants are working. Most activities in town councils really are working.
Okay, your final word to the viewers of Morning at NTV.
My last word is, as Ugandans, we have a war. It's a battle, a war for all of us to survive. And this war is preventable if only we can have people who are, or if only people can help us and they observe the SOPs. If you can put on your mask, if you can avoid congested areas, if you can sanitize or wash your hands regularly. So these SOPs are worldwide. These are the only preventive measures. Of course, sometimes now, like how I am now, it's not comfortable for me to put on a mask. But it's not as hurting than me being in ICU. You understand what I'm talking about? It's uncomfortable for me to put on a mask, and I really feel it. But
and the people are worried about the cost of
yes,
taking care.
But the cost a person undergoes through while in ICU, or even when you have lost your life, is not commensurate to putting on a mask. So I request our people, but I want to appreciate. I want to thank our health staff who are helping us to manage this pandemic in the hospitals and everywhere, including private hospitals. But the private hospitals, you are in limelight today for exorbitantly charging our people. Lastly, I want to thank Ugandans for the support they have given me in my office. Then I want also to thank the president, but also for the trust he gave me.
Okay, but in 1 minute, just also want to understand, because very many journalists also, they'll kill me if I don't ask you, because they also feel they should be part of this group, because many of them are not doing well. Just like me, I think we need to be also part of that group.
But journalists are still working. Journalists, you are still working. Even here, you are working.
You even say the border borders are also working, but also
the border borders, because we denied them the other opportunity of calling people. I think that's where they have business.
All right, thank you so much, Right Honorable Robinah Nabbanja. She's also the woman member of Parliament for Kakumiro, where she has been representing the people of that side for quite a long period of time. And Stephen Imbidon Fefeswe Chibuga been here with her, briefing us about the update on the relief aid that government is going to be, of course, disbursing to those vulnerable groups. Back to you, Andrew Chamagero Mutuawansi, in the studios for me. Have a blessed
weekend. And I'm grateful. Very pertinent questions. But before you leave, I want the Prime Minister to answer the question about the NIN number. There are rumors going around that those who don't have NIN numbers won't have, the benefits to this.
Indeed, Right Honorable, there is word moving around that those without NIN numbers and those who even lost their mobile phones, how will they access this money?
I contacted the service providers. I had an interaction with the MDA of MTN, the executive director of Airtel. We were going to use those two companies, and I told them, suppose I don't have a phone, suppose I don't remember my PIN code, and what happens? Then they told me, remember, before we used to have people without mobile money accounts, and during that time, then you would say, for example, MTN, you will use any other number and say 165 star 165 hash. It is put in your name. When you put in your name, Then it will tell you how old are you. Then you put in your age, which village. Then you put in a village. Then because they will have the data, then it will give you a PIN code. And you go with that PIN code to the service provider, and that service provider will give you money. Because you would then have that PIN code, you would go to the service provider. Because the other time, remember, we were talking of vouchers. But again, when Cabinet said no, the vouchers can easily be abused.
Lastly, how will you deal with the mafias? Because they are also looking at this money, the 50.7 billion.
We need to ask Ugandans. We are looking at needy people. And needy people are really needy. So we want to be as transparent as possible.
Okay.
That's why we are saying, let us display these lists, such that Ugandans can say, no, the Nabbanja you have put on this line is a prime minister, and the prime minister cannot be poor. So that now the committee, where the chairman LC1 will be, the Paris councillors will be, where we shall have the PISO representing the ISO. And of course, we shall have also monitors, the members of parliament, the ministers. We are all going to see how best we can. And we shall also do random sampling. Say, for example, if you have given me 100 names in Ibataka zone, where I stay, then we shall get like 20. Then sample, go there and see, are these really vulnerable people? We shall sample. But we want to do this concurrently because we don't have time.
Thank you. Good enough, there is also the involvement of local leaders, and I know that you local leaders, you should be also active at this particular time. Back to you, Andrew Chamagero Muntu wa Wansi, Stephen Ibido, Professor Chibuga, just wishing you a nice weekend for now.